Elevated blood pressure or hypertension is the most significant contributor to complications such as heart disease, stroke, peripheral vascular disease, and kidney failure. The consequences of these complications are devastating and deadly. It is important to remember that hypertension is the most significant preventable cause of cardiovascular and renal complications and premature death. It is the responsibility of the provider and members of the healthcare team to use a collaborative approach with proper blood pressure technique, education, understanding of the disease process, medication adherence, lifestyle changes, and the importance of data in hypertension population control. This is increasingly important with the newly released blood pressure guidelines. This series is designed to assist clinical teams to utilize a systematic approach to improve processes in their practices to ultimately improve blood pressure control. Welcome to Session 3. Each session builds on one another, so it may be beneficial to view them in order. The team should have their baseline population and aim statement defined. Before moving forward with the specific tools of performance improvement that will help the team analyze and study the baseline data, this session will focus on proper technique of the blood pressure measurement. An accurate measurement of blood pressure is common and one of the most important clinical measurements performed in healthcare. Clinical staff perform the measurement of blood pressure multiple times every day. Yet, the American Heart Association report that blood pressure readings are one of the most inaccurately performed measurements in clinical medicine. Accurate measurement is critical. It is time to take a fresh look at the blood pressure technique. Take a look at the 3 points in the slide. Can you identify the photo where the technique is being done correctly? If you said the correct blood pressure technique was lacking in all pictures, you are correct. Stay tuned to learn why. Let's begin this session with a brief assessment of the knowledge of blood pressure. After each question, the session will pause to give the viewer time to answer before the correct answer is identified. Let's get started. Question 1. A 61-year-old woman who has no chronic disease has her blood pressure checked. The reading is 136/88. You tell her. This session will pause briefly so the answer can be considered. How did you answer? The answer is B. The diagnosis of hypertension is up to the physician. Question 2. A large man comes in to have his blood pressure checked. What cuff do you use? This session will pause briefly so the answer can be considered. How did you answer? This question has 2 answers. A. The cuff that has a bladder that encircles 80% of the circumference of the arm, and D. The cuff that is the correct size determined by measuring the circumference of the arm with a tape measure. Question 3. How high do you inflate the cuff when measuring blood pressure? This session will pause briefly so the answer can be considered. How do you answer? The question is D. Palpate the radial artery, inflate noting where the pulse disappears, deflate, and then pump 30 mmHg higher. Question 4. What can cause a false high blood pressure reading? Choose all that apply. This session will pause briefly so the answer can be considered. How did you answer? This question had 4 answers: A, C, F, and G. A. Crossed legs can cause a false reading. C. A cuff that is not the right size and affect blood pressure. F. A need for the patient to empty the bladder or bowels can affect the blood pressure. And G. Patient talking during the measurement can affect the measurement as well. Question 5. A man comes in to see you for the first time. What arm should you use when taking his blood pressure? This session will pause briefly so the answer can be considered. How did you answer? The answer is C. Blood pressure should be assessed in both arms to determine which arm has the higher reading. Question 6. What is the most common error made by healthcare workers when taking a blood pressure? This session will pause briefly so the answer can be considered. How did you answer? The answer is A. The cuff must be the right size for an accurate reading. Question 7. A person comes to the office for a blood pressure check. The first blood pressure reading is 146/90. You wait 30 seconds and repeat. The second reading is 119/78. You should then... This session will pause briefly so the answer can be considered. How did you answer? The answer is D. Wait 2 minutes, repeat the measurement twice, and record the average of the last 2 readings. If you got 6 to 7 correct, you are a star performer in blood pressure technique. If you got 4 to 5 correct, good for you. But skills may need a little tweaking to ensure a correct reading. If you got fewer than 4 correct, don't feel badly. An unscientific poll in a group of nurses showed a difference in how blood pressure was taught and performed, and none was perfect. The equipment materials needed to support an accurate blood pressure reading and patient education should include a chair in which someone can sit with their back supported and feet flat on the floor, a table or counter with space on which someone can rest their arm level with their heart, or a chair with adjustable armrests. The upper arm should be at the level of the heart mid-sternum. 4 sized cuffs readily available, pen, paper, and calculator for averaging readings. To calculate the average of 2 readings, add the systolic numbers together and divide by 2, and do the same for the diastolic. For example, if the first systolic reading is 200 and the second reading is 172, the total would be 372. Divide 372 by 2, and the average of the systolic is 186. If the first diastolic reading is 92 and the second is 86, the average would be 89. The average of the 2 readings to record is 186/89. A tape measure may be handy if there is uncertainty about cuff size. Health messaging materials should be convenient and accessible for the patient's education. A wallet card or other tool for documenting the blood pressure and arm used for the measurement should be available to give the patient. Aneroid sipho-manometers that are wall-mounted are preferred. They are more accurate and stay in better calibration. Please check with the manufacturer of the equipment being used for guidelines on calibration. For a busy primary care office, the automated variety may be the more prudent, repeating the measurement by oscillation and/or by the provider if the reading is questionable or the patient is typically one of the uncontrolled population. Wrist monitors are not recommended, and a soft cuff opposed to a rigid cuff is better as the rigid one has the tendency to slip. The table on this slide shows the impact of how variable a blood pressure reading can be if the proper equipment is not used or calibrated, or the patient's position or cuff position is incorrect. Errors as small as -2 to 5 mmHg can have an outstanding health impact to the patient and cost to the healthcare system. An error of only -5 mmHg at the 90 to 95 mmHg range will miss the 21 million hypertensive patient in the United States in this range. Keep in mind that offices are often chilly and cold causes vasoconstriction, decreased blood flow, and cause a low reading. This table shows other causes of misinterpreted reading. It is important to assess other reasons for high reading that may not be related to a diagnosis of hypertension. Measuring blood pressure falsely high increases costs by treating those who do not truly have high blood pressure. An error of +5 mmHg would move 27 million people from the 85 to 89 mmHg range into the high blood pressure range. Since the estimated cost of treating one person with high blood pressure is $1,000, this would increase the cost to $27,000 per year to treat a non-disease. Overall, 1 in 3 adults have hypertension. Men are more susceptible to hypertension. After age 65, women are more likely to develop high blood pressure. African Americans are more at risk for hypertension. Take a look at this fun video by Suntech Medical that reviews the fine points of manual blood pressure technique.
I honestly can't stand this training video, but they make a show to all the rookies. To say that it's dated would be kind, but with tight budgets, you get what you can get and you don't get upset.
How to measure blood pressure. Hello, my name is Dr. Ralph Elliott Holloway III, Chief of Staff here at Lost Hope Hospital. Remember, it's important that you maintain a professional work environment so that the patient feels comfortable and reassured. Make certain that your uniform is pressed and that you look your best. The floor must be clean and the ashtrays emptied. Now you are ready to take the patient's blood pressure. With the help of my lovely assistant, I will now demonstrate the proper technique for measuring blood pressure. Well, that's just fine. 120/80. You're as healthy as a June bug in June. Thank you, Tina. And that's the proper way to take a blood pressure reading with cleanliness, courtesy, and...
Condescension? Yeah, thanks for nothing, Dr. Holloway. That video is so bad. Oh. Okay, how about we discuss how to really take a patient's blood pressure?
Isn't that what we just saw?
No.
Okay.
We're going to need a stethoscope and a sphygmomanometer.
A what?
A sphygmomanometer.
A sphygmomanometer?
A blood pressure cuff with a gauge and squeeze bulb attached.
Oh, that. I'll be right back.
Okay, now before putting the sphig on a patient, there are a few caveats.
Cavities?
No, things to consider.
Oh.
The patient should be seated with their back supported and feet flat on the floor. They should be seated for at least 5 minutes before taking their blood pressure. So use that time to get information for the chart and ask questions that deal directly with their blood pressure, like, did you have any caffeine within the last hour?
No.
Did you have a smoke within the last hour?
No.
Are you under any unusual stress?
I'm getting there.
Do you have to pee?
Are these questions still hypothetical?
Yes.
Then hypothetically, no.
Okay, now I want you to put the cuff on my arm.
How about them apples?
How about trying that again?
What? Really?
Look, a few words about cuff placement. First, if you don't use the right size cuff, you will not get an accurate blood pressure reading.
How do I make sure it's the right size?
Well, you could always use a tape measure. Every cuff has a range printed on it in centimeters.
But what if I don't have a tape measure?
Well, the cuffs have range markers printed on them too. If the index line is outside of the range markers when it's wrapped, use either the next biggest or the smallest cuff. Very simple.
Yeah, I think even I can do that.
Also make sure that the artery marker on the cuff is lined up with the brachial artery.
Oh, that's the same place I put my stethoscope, right?
Well, not necessarily. On the upper arm, the brachial artery is on the inside of the arm, between the tricep and the bicep. But it's on top of the forearm when the patient's palm is facing up. You got that?
Yep. I mean, this seems like a lot of trouble. Why don't we just use one of those newfangled automatic blood pressure machines? Since it's all automated, we don't really need to worry about sizing and artery placement and all that, right?
Well, that's wrong. Correct cuff sizing and placement is even more important for automated devices than for old-fashioned manual ones.
Really?
Really. For modern automated machines, the cuff is extremely important. I want you to think of it as kind of a finely tuned, highly calibrated sensor. You use the wrong sensor, you get the wrong reading.
Oh, I see.
Yeah. Now show me how to put the cuff on the right way.
All right. Is this okay?
Okay, not bad. Now go ahead and take my blood pressure and make sure that my upper arm is supported and resting at the same level as the heart. Quick comment here.
Shh.
But
The patient's not supposed to talk during the blood pressure measurement. Well, it was a little difficult to hear what with the patient trying to talk to me and all.
Doesn't matter.
What do you mean it doesn't matter? Of course it matters.
Well, I mean, you're right. The patient's not supposed to talk. But it doesn't matter because you were deflating the cuff too fast.
Too fast, but I could hear the K sounds even though you were talking.
But when deflating too fast, The first and last K sounds that you hear may not be the first and last K sounds.
Should I not be confused by that statement?
Okay, look. If you want an accurate measurement, you have to deflate slowly, no more than 3 millimeters per second.
But that's so slow. And my hearing's just fine, you know.
It has nothing to do with your ability to hear, Pinhead. If the heart's between beats when you fly through the systolic pressure at 10 millimeters per second, there won't be any sound to hear.
Oh, yeah, I see what you mean. Okay, so deflate slowly. Got it.
Okay, so let's review, shall we?
Sure.
Okay, tell me about the patient.
The patient should be sitting down with feet flat on the floor and back supported.
Check.
They should be seated for 5 minutes before taking a reading.
Check.
Ask about recent caffeine intake, smoking, and bladder relief.
Check.
Check cuff size.
Check.
Check cuff placement.
Check.
Check deflation rate, 3 millimeters per second only, please.
Check.
Check that arm is at heart level.
Check.
Oh, never place the cuff over heavy clothing.
Check.
No talking during the measurement.
Check. Good job.
Check.
Well, you can stop saying check now.
Roger that.
Stop it.
That's affirmative.
Are you trying to be funny?
That's a big 10-4, good buddy.
I am not your buddy, so stop that.
Oakley dokley, nurse friend.
Can it? Aren't there some bedpans or something you can be emptying?
That is gross, but I will do it if I have to. Okay, almost. Yep. Oh. Oh, yeah. Oh, no. No. Oh, that's a bummer.
Competencies ensure that staff who do certain skills are following proper procedure to get the correct outcome. In our case, a correct blood pressure reading. Staff who take blood pressures should be assessed for skill, competency, and accuracy at hire date and at least annually. New hires should go through an educational session followed by observation. It is a good idea, if you are asking this series for a performance improvement activity, that staff taking blood pressures are assessed for competency. This website on the slide has a nice skill testing sheet that can be used for that purpose. Blood pressure technique is not a one-size-fits-all practice and should not be rushed. There is a significant variability in improper cuff size and other technique. There can be variability in blood pressure reading, even the proper procedure if followed correctly. The important thing is to get the patient's position correct and be aware of the other variability issues to determine if a manual blood pressure is the better choice for a particular patient. Before the next session, think about the many reasons why patients have uncontrolled blood pressure within the baseline population. Write the reasons down one reason at a time on a sticky note and have the reason readily available when the session is reviewed. It doesn't matter if there are duplicate reasons. Duplicate reasons help us know more about the practice and the HTN population. See you next session!